It's a pleasure to be here. Good morning, everybody. So Bill had asked me to present some of the research that we've done at Boston Children's Hospital, all in 3 slides. So I decided to present data from this study that we published in 2012. Okay, so I have 3 slides. The first one is on study design. Then I'll give you some idea of exactly what we did for the intervention, and then I'll briefly present the results. So in this study, we had an intervention period and a follow-up period. During the intervention period, we delivered non-caloric beverages to the homes of adolescents whom we enrolled in the study. That was for the experimental group, and we provided supermarket gift cards to the control group. The subjects were 224 adolescents, approximately equal numbers of boys and girls, and all of them were overweight or obese at baseline. The other important thing with regard to recruitment is that all of these adolescents were drinking at least 1 serving, specified as 12 fluid ounces per day, of a sugary beverage. Okay, so in terms of our data collection, we had baseline data collection that included assessment of BMI and 3 24-hour dietary recall interviews that were done by telephone using the nutrition data system for research. These measurements were repeated at 1 year and also at 2 years. And because it was a research study, we did provide gift certificates in the amounts of $50 at 1 year and $100 at 2 years, and I think that did contribute to our excellent retention rate. The other thing that contributed to this retention rate is that we recruited the adolescents with the help of schools. So it was not a school-based intervention, but we worked with schools to recruit the adolescents, and we also did the assessments at the schools. So if they didn't show up for their assessments, we knew where to find them. So, in terms of the intervention, given that this roundtable discussion today is focusing to some extent on what we might be able to do, I thought I'd give you an idea of what the different components were of the intervention. The home delivery that I mentioned with the previous slide was home delivery of non-caloric beverages every 2 weeks. These beverages were water or diet beverages. The adolescents could select what they wanted, and we also provided some for other members of the family so there wouldn't be competition for these beverages. I'd also like to emphasize that unsweetened water was recommended over the diet beverages. We viewed diet beverages as a sort of stepping stone from the sugary beverages that they were drinking to consuming water. In a follow-up study where we're analyzing the data now, we actually did some direct comparisons between groups that were receiving sugary beverages, artificially sweetened beverages, and unsweetened beverages. This study was not designed to make those types of comparisons. The adolescents received written intervention messages to drink the delivered beverages instead of sugary drinks and not to buy or drink sugary beverages. We got the parents involved by doing motivational telephone calls with parents. These were done monthly. They were 30 minutes per call, and they focused on stimulus control or getting beverages out of the home and role modeling, asking the parents not to drink the beverages that we were asking their children not to drink. We also did check-in visits with participants. There were 3 of these during the intervention period. They were about 20 minutes per visit, and they were done under the theme of think before you drink. So we had like refrigerator magnets where they got these think before you drink messages. Since then, we've used these messages in other contexts and found that they do resonate with the kids. I can tell you more about those if we have time for discussion. So I tried to slip in some extra data here on a single slide given my limit, but given that the animations aren't working, my my data on sugary beverage consumption is not showing, so I'll just describe it. At baseline, the adolescents were drinking about 1.7 servings per day on average. With the intervention, for the experimental group, we brought this down to just about 0. So this fairly comprehensive intervention was effective in reducing sugary beverage consumption. There was an increase in artificially sweetened beverage consumption at 1 year that was no longer present at 2 years for the experimental group, suggesting that this idea of using the artificially sweetened beverages as a stepping stone did indeed work, and we were able to increase consumption of water. So these are the data. At 1 year, we saw a smaller increase in body mass index for the experimental group compared to the control group. This equated to 0.57 BMI units, or about 2 kilograms, which translates into just over 4 pounds difference between the two groups. With discontinuation of the intervention at 2 years, we did not see a difference. One thing in terms of the beverage consumption, we also noted that there was a decrease among those in the control group, which we think may have something to do with secular trends and elimination of sugary beverages from some of the schools. So that's it in a nutshell. I'd be happy to take any questions.
So what was the beverage consumption level in the red group at 2 years?
Boy, I don't remember the exact number. I wish the animations had worked so I could show you the exact data. But I have it on my computer, and I'd be happy to share it with you at some point. I just don't want to misspeak when I.
So, Cara, I'm really interested in the emerging literature around the addictive properties of soda and the combination of sugar and caffeine, since 80% of what youth are drinking actually also contains caffeine. So I get that in the intervention group, they still may have had caffeine in their beverages and certainly some sweet taste. But did you do any measures of well-being or cravings or anything that might get at those addictive properties?
We did not. It was in a school setting. We focused specifically on our primary outcome, which was BMI, and did not start looking at some of these things that may be contributing to the consumption.
Were you able to adjust for bad role model parents?
No, we were not able to adjust. That would be a very hard variable to collect with any accuracy, I think.
I have another question on data collection. I'm guessing that you didn't measure blood glucose or triglycerides based on, no?
We did not. The study that we more recently finished up and have not yet finished analyzing the data for, it was done in young adults, and we were able to get blood samples, and we'll have data with regard to lipids and glucose and insulin and a little bit more comprehensive data. In this study, the blood draw would have been a big issue when recruiting students in schools, so we just maintained our focus on the body mass index variable.
Cara, here. Did you look at the moderating influence of physical activity or fitness?
We controlled for it, but there was no effective
No variation
on physical activity. Looking at Michael Gorin here, and thinking I should also mention that we did see effect modification by ethnicity, and Michael and I have talked about that. So a lot of what was driving this outcome was the effect among the Hispanic population. They were also a relatively small group of this study.
In Boston.
So it's something that's provocative, but certainly requires additional research.
Needs to be done in California.
Well, yeah, we'd like to do that. But yeah, so there was some effect modification. In terms of effect mediation, the only effect mediator was sugar consumption, as one would expect. So, and the only effect modifier was ethnicity.
So a greater increase in the Hispanic? A
Yes.
greater decrease?
A greater difference between the two groups, with those in the experimental group who received the non-caloric beverages showing less weight gain than those who didn't get the
Got it.
intervention.